Now we know it's important to restore the native laxities, but it's equally important to restore the native tibial compartment forces in the medial and lateral gaps, which reduces the risk of stiffness and motion loss. So we're going to use some excellent work from Matthias Verstraete, and they looked at the contact forces in the tibial femoral joint. This is a normal knee now, from soft tissue tensions, and made some implications in terms of soft tissue balance in a total knee arthroplasty. So they're going to give us the values for the native knee. How did they do that? They averaged the forces at full extension, 45 degrees and 90 degrees. So they added the 3 up in the medial compartment, divided by 3, and that's the mean force in the medial compartment through that arc of motion. And they did the same for the lateral compartment. So if we plot the medial force and lateral force, averaged from 0 to 90, in the x-axis and the tibial compartment force in pounds, you can see the medial force is 14, the lateral compartment is 6. So the medial force is about twice as much as the lateral force. Sort of makes sense because the medial plateau is bigger than the lateral plateau. So if the force is bigger and the cross-section area of the plateau is bigger, then the the stress or pressure, if you will, is about the same or not too different between the medial and lateral sides. So this sets what I would consider, and I think Verstraete considered, to be the ideal target for all total knees. You want the average force from 0, 45, and 90 in a compartment to equal 14 on the medial side and 6 on the lateral side. That's what we should strive for. Now, do we achieve this goal? Well, we looked at this and measured it in vivo in osteoarthritic patients using the Varosensor ortho sensor. And this video shows with cemented femoral and tibial components and the ortho sensor insert, the forces in the medial and lateral compartment as we gently flex the knee. Notice that I could not see the forces until after the operation was over, so I didn't use these values to adjust or balance the knee. I made the assessment of balance based on these verification checks and decision tree. So just to show you, at full extension, the medial force was 37, the lateral was 6. At 10, it was 21 and 6. At 45 degrees, it was 21 and 6. And at 90, it was 11 and 0. And so we average the 3 in each compartment and we get a force. So if we look at the Calipered kinematically aligned TKA forces in blue and compare them to those of the native knee, 14 and 6 in the medial and lateral compartments, you can see that in the paper by Shelton, the values were 18 for the medial compartment after total knee replacement in 67 osteoarthritic knees, and in the lateral compartment the force was 7. And this is no different than that of the normal knee, and this was done without ligament release. Now, to find out how sensitive the knee is to adding a thicker insert of 2 millimeters, which increases stiffness, we conducted an experiment where after we made these measurements, we took out the Varosense, we put another one in that was 2 millimeters thicker than the one that we actually implanted in the patient. So this just shows this 2 millimeter thicker insert growing, if you will. And what it did is it caused a measurable loss of 3 degrees of extension, 3 degrees of flexion, and 3 millimeter increase of the anterior translation of the tibia on the femur at 90 degrees, which is not shown here. So these are measurable quantities of stiffness that the patient would notice. They can't straighten and bend the knee as much, and it's tight when they flex the knee. So a 2 millimeter thicker insert. So how much do you think this causes an increase in force? So if we go back and we plot now the native knee in green, the ideal or optimal insert in the Calipered kinematically aligned TK with no ligament release, and now in magenta we put a 2 millimeter thicker insert in, you can see that it doubles the medial force and almost doubles the lateral force. So you have to be careful. A 2 millimeter thicker insert than optimal can cause a large increase in force, creating stiffness, loss of flexion, and extension. Now, how does this play out with mechanical alignment? You know, mechanical alignment total knee arthroplasty, we're indebted to Meningini and his group, 3 surgeons. 2 did mechanical alignment with nav and 1 did gap balancing. They're the only study that I can find in the literature that publishes their forces. Everybody else publishes ratios, medial force to lateral. It's useless data because you could have 14 pounds medial, 7 lateral, a difference of 2. So double force in the medial than lateral, but it could also be 1400 versus 700, a difference of 2. So reporting data as ratios, those studies really should just be disregarded. We're indebted, as I said, to Mangini because if you look at their group of patients treated with mechanical alignment with measured resection checked with nav in the medial compartment after they did releases was 74 pounds, and with the lateral compartment was 45. And if we look at what happened when they did gap balancing, 58 in the medial compartment and 40 in the lateral compartment. These values are 4 to 3 times higher than the native force or the calipered kinematically aligned TK without release, and 6 to 5 times higher in the lateral compartment, and they're worse than just putting in a 2 millimeter thicker insert. So it's very difficult to truly balance a mechanically aligned total knee arthroplasty even with ligament releases because the implants are not restoring the native joint line, which means some of the implants are outside the bound of the native surface, which gives high forces. And when these forces are as high as they are in this situation here, it's 74 pounds medial and 50 or 60 pounds laterally. That means that the implants are beyond the bound of the native surface, at least 3 to 4 millimeters, which is probably a good cause of stiffness in these patients.